Good afternoon. I'm Tracy Sinclair here at Alaska's News Source, and October is Breast Cancer Awareness Month, and I'm a breast cancer survivor, so it is an important topic to me. I really want to spread the word about early detection and how important it is. And so one of the people that's going to help us talk about that today is Lauren Yeager. She is the mammography specialist or supervisor over at Providence Imaging, and I really appreciate you stepping in to talk to us today. Kind of give us an idea, how important is early detection in searching for breast cancer?
Early detection, it's really important. So if you are getting screening mammograms, often mammograms are going to find a cancer before you can feel it. And so if they're able to find a cancer when it's in its early stages, then you have a lot better treatment options, a lot better prognosis. It's just much better to catch things early.
And that was my case, is that my cancer was too deep that there was no way that you were going to feel it in a self-exam. It was just too deep. So the mammogram is absolutely what found it. Who should be getting them? Sometimes these rules change a little bit on who should be getting mammograms and at what age should they start. So what is the pervading theory right now?
So we recommend screening mammograms start at age 40 for most people. There's some people who have a first degree relative who had breast cancer really young. Like for instance, if your mother had breast cancer in her 40s, then it might be a good conversation to have with your doctor to maybe start a little bit earlier than 40. But for most people, 40 years old is the time to start. And then we recommend getting them annually after that.
And so for somebody who hasn't gone through this, because I was shocked in my brain, I think I started at 40. This was when my cancer was discovered at 48, certainly was not my first one. I think there are some people that don't quite know what the experience is like. Give us kind of a description of what's going to happen when somebody gets in to get their first mammogram.
Okay, so when you come in to get your first mammogram, you'll come back to our mammography department. They'll have you get changed into a gown, and then a technologist will bring you into an exam room, and they're going to go over all of your personal and family history. And then for the mammogram itself, it's typically about 4 images. So they're going to take 2 images of each breast from a few different angles. They'll use compression, but the compression, it's usually not too bad. And the technologist is able to work with you to make sure that that's comfortable.
Yeah, I think that's the question a lot of people have is, does this hurt?
It should not hurt. We have curved paddles now as well, and so it actually makes it even more comfortable now than it used to be.
Oh, okay. So that's really interesting because obviously they didn't have those. It's a new technology, and that's great. When you run into somebody who, says, "Oh, I don't have a family history, I don't have to worry about it," what do you tell them to say, no, this is really something that every woman should do?
So about 85% of the people who get breast cancer do not have a family history. People who have a family history may be more likely to develop breast cancer, but the majority of breast cancers that are found are not because the person had a family history.
And I know that how do you calm someone's fears when they come in and they're kind of like, I'm nervous, I don't know what this is like. What do you say to them to kind of ease their fears as they're going through this?
I think that a lot of information tends to help people. People tend to be more nervous because they don't know what to expect. They don't know what's happening. So we just, explain what we're doing as we're doing it. And then that tends to calm most people's fears. And honestly, most people that come in, they're stressed out until they get that first image, and then they realize it's not going to be painful, and then they're completely fine for the rest of the exam.
And I believe, and I forgot to talk to you about this beforehand, but you guys also have a mobile mammography truck.
We do.
What is that? And if somebody can't come to you, how does the truck come to them?
So our mobile mammography truck, it goes all over Anchorage, and then it goes, pretty much anywhere on the highway system between maybe I would say Seward and Talkeetna. And it's got the same mammogram equipment that we have here at the imaging center. So anybody that's going to the mobile is going to get the exact same mammogram they would get here in town. And it pretty much, we can go anywhere. It's very easy to schedule the mobile to come to a facility, a business, pretty much anywhere.
And so once the images are taken, how long does somebody have to wait to find out if there's anything of concern that they need to check on?
It's usually within just maybe 2 days. The radiologists read it pretty quickly. Sometimes it's even the same day. And then for Providence, we have My Chart. It goes straight to the patient's My Chart. And then if anything else is needed, we also call the patients within the next day or two.
So the technician is not going to be able to look at it and say, you're good, you're clear. You don't walk out of there going, I'm done.
Our job is to make sure that we got the best images possible, and then we send those off to the radiologist, and the radiologist is the one who reviews the images.
And so if you could spread a message to the women of Alaska, because that's who we're mainly talking to, what would you say about early detection and getting a mammogram?
I would just say, please come see us. Please come see us. Bring your questions and concerns. We're happy to talk to you. We can answer anything. Mammograms are so easy to do, and there's such an easy way to find an early breast cancer. And if we find it early, we can treat it so much easier.
Like I said, mine would never have been felt, so I absolutely agree with this. I'm definitely a proponent for people getting their mammograms. And we said starting at the age of 40 and then doing them annually. It really can save your life. So Lauren Yeager, thank you so much. She is the mammography supervisor over at Providence Imaging. We really appreciate you stepping in and talking to us for a few minutes today.
Absolutely. Thank you, Tracy.
Thanks. And for the rest of you, you can always find more on our website, alaskasnewssource.com.